dear friends, colleagues, partners, ladies and gentlemen. I would like to welcome you tonight on our seventh Brainstorm Talk on the topic of AI in the healthcare industry. I hope all of you are doing fine and you're also healthy, and thank you for joining us this evening. As you can see, I have started sharing my screen with you. We have prepared a small presentation in the beginning of the event. And today we're also pleased to welcome a special guest speaker. His name is Georgi Kadrev, and he's the founder and CEO of Kelvin Health, which is a deep tech startup applying thermal imaging AI on a journey to make remote disease screening as easy as taking a selfie, and thus allow the ultra early diagnosis of various medical conditions where prognosis is positively influenced by early discovery and detection. But before going to that point, as usual, I would like to take you through some logistic steps. On the first place, as always, this discussion and session is being recorded, and we are also live streaming it on our social media channels. So the recording will be available afterwards. And if you feel like switching off your camera, you're more than welcome to do so. Please also mute yourself, stop your microphone, and please remain so for the duration of the discussion. If you have any pressing questions, you can definitely use the chat function located on the sidebar. And at the end of the presentations, we'll have a dedicated Q&A session, a Q&A part, so you'll be able to ask all of your questions. And now, what to expect from the brainstorm talks today? Now, maybe some of you already know about our events, but just giving a little bit background one more time, very briefly. Today's talk is part of a bigger joint effort organized by two organizations, Artificial Intelligence for Development Agency, or AIDA, whose mission is to support local and global communities by engaging with AI topics, empowering them to discover how technology translates into their own lives. And also JAMBA, Career for All, whose mission is to support people with different types of disabilities and chronic illnesses to attain key competences, soft and professional skills in the area of AI and IT. And as a follow-up step, JAMBA supports talents with disabilities to find jobs by connecting them with employers. And our main mission with the Brainstorm Talks is to provide education, knowledge, and deeper understanding of social issues related to the AI topic. And it's a program of 10 talks in total. Today we have our 7th one. And as you can see on the slide, on 19th of May will be our 8th talk. And the topic will be big data. So stay tuned, please share the upcoming event, and you're more than welcome to join it as well. As of today, we'll briefly discuss the role of AI in the healthcare industry, what are the current trends, some very interesting and useful tools, and also what we can expect from the future. Then I'll give a very brief introduction about these topics, and I will give afterwards the floor to our speaker, Georgi, who is going to share his entrepreneurial experience at Kelvin Health. And also he's going to share some very interesting projects that they're working on right now. And after Georgi's session, presentation, we'll have a dedicated Q&A part. Now, how does the big picture look like? Big data and machine learning are having an impact on most aspects of modern life, from entertainment to commerce to even healthcare. And if I have to be more specific, for example, Netflix knows which films and series people prefer to watch. Amazon knows which items people like to buy, when and where. And also Google knows which symptoms and conditions people are searching for. So there is a great optimism that the application of AI can provide substantial improvements in all areas of healthcare, from diagnosis to treatment. And it normally simplifies lives of patients, doctors, and also administrators by performing tasks that are typically done by humans, but in less time and also at a fraction of the cost. Of course, there are many different applications of AI in the healthcare industry, but today we're going to discuss 5 different roles that we are focused on. On the first place, misdiagnosis, illness, and medical errors are the reasons for many people deaths around the world. And in light of that, the promise of improving the diagnostic process is one of the AI most exciting healthcare applications. Incomplete medical histories and large caseloads can lead to deadly human errors. And also, immune to those variables, AI can predict and diagnose disease at a faster rate than most medical professionals. For example, there is a study on an AI model using algorithms and deep learning diagnosed breast cancer at a higher rate than 11 pathologists, 11 physicians. The second thing is that in the healthcare industry, time is money, and we all know that. And efficiently providing a seamless patient experience allows hospitals, clinics, and physicians to treat more patients on a daily basis. So new innovations in AI healthcare are streamlining the patient experience, helping hospital staff process millions, even billions of data points faster and more efficiently. And thanks to AI, methods for individualized medical treatment have been developed, and now patients can get the right treatment at the right moment, which is definitely very, very crucial for the success of the treatment. Popularity of robot-assisted surgery is at the moment skyrocketing, and hospitals are using robots to help with everything from minimally invasive procedures to open heart surgeries. And robots equipped with cameras, mechanical arms, and surgical instruments augment the experience, skills, and knowledge of doctors to create a new kind of surgery. Also, robot-assisted surgeries have led to fewer surgery-related complications, less pain, and also quicker recovery time. Another topic is that research and development of medicine normally takes thousands of human hours, and it's very costly. It costs billions of dollars to put each drug through clinical trials, and only 10% of those drugs are successfully brought to market. Imagine that, only 10%. And due to the breakthroughs of technologies, biopharmaceutical companies are quickly taking notice of the efficiency, accuracy, and also knowledge that AI can provide. And last but not least, highly valuable information can sometimes get lost among the forest of trillions of data points and losing the industry loads of money per annum. Additionally, the inability to connect important data points slows the development of new drugs, preventive medicine, and proper diagnosis. Therefore, there are a lot of companies existing on the market that by taking data from existing sources can foretell everything from who might get sick to, for example, what's driving up the hospital's healthcare costs. And of course, AI can support the treatment of many different illnesses. On the first place, it can be used for cardiovascular disease treatment. And there is a company called Ignite, whose cardiocare program is one of the industry leaders in structural heart data, analytics, and clinical process improvement, reducing variability in diagnosis and improving guideline-directed treatment for structural heart disease. On the second place, we can use it for treatment of life-threatening cancer. And for example, the company called Freenome uses AI in screening, diagnostic tests, and blood work to test for cancer. And by developing AI at general screenings, Freenome aims to detect cancer in its earliest stages and subsequently develop new treatments. On the next place, we can use it also for neurosystem diseases. Deep Genomic is an AI platform that helps researchers find candidates for developmental drugs related to neuromuscular and neurodegenerative disorders. And finding the right candidates during a drug development has statistically raised the chances of successfully passing clinical trials while also decreasing time and cost to the market. And last but not least, AI can definitely improve the quality of life of many people around the world who face some form or type of disability. Applications of AI in neurology can be seen in cases of spinal cord injuries. And for example, machine learning algorithms can be used to decode the neural activity and control activation of forearm muscles to custom-built electrical stimulation system. And this, for example, helped a 24-year man who had a previously lost function in his hands and arms due to spinal cord injury to once again grasp, manipulate, and also release objects. So imagine that this represents not only an important contribution to the neuroprosthetic technology, but also has an important and direct implications of people living with paralysis around the world. And of course, unfortunately, AI in the healthcare industry can come also at a higher cost. The most obvious risk for that is definitely that AI systems will sometimes be wrong, and that the patient injury or the healthcare problems may result. And if an AI system recommends the wrong drug for a patient, fails to notice a tumor on a radiological scan, or allocates a hospital bed that one patient over another because it's predicted wrongly which patient would benefit more, the patient could be injured. On the second place, training AI systems required large amounts of data from sources such as electric health records, pharmacy records, insurance claims records, or consumer-generated information like fitness trackers or purchasing history. But health data are often problematic and is typically fragmented across many different systems. And even aside from the variety just mentioned, patients typically see different providers and switch insurance companies, which can lead to data split in multiple systems and multiple formats. And this fragmentation increases the risk of error, also decreases the comprehensiveness of data sets, and increases the expense of gathering data, which also limits the type of entities that can develop effective healthcare AI. The next thing is that risk can arise around privacy. The requirement of large data sets creates incentives for developers to collect such data from many patients. And some patients may be concerned that this collection can also violate their privacy. Therefore, lawsuits have been filed based on data sharing between large health systems and also AI developers. And last but not least, there are risks involving bias and equality in the healthcare industry. AI systems learn from the data on which they are trained, and that can incorporate biases from those data. For example, if speech recognition AI systems are used to transcribe and counter notes, such as AI may perform worse when the provider is on race or gender underrepresented in training data. And now, after this short presentation from my side, I would like to give the floor to Georgi Kadrev, who started his computing programming in 1994 at the age of 10, and later on his professional career as a software engineer in 2004. In 2008, he founded the deep tech company Imaga out of his living room, and now the company is a leader in the area of image recognition. Georgi is also personally named one of the 30 under 30 by Forbes Bulgaria in 2013. And most recently, during the start of the COVID pandemic lockdown in March 2020, he co-founded Kelvin Health. So Georgi, thank you so much for being here with us today. The floor is yours.
Thank you very much, Eva. It's a pleasure to join this online event, and thank you for the opportunity. I hope it will be interesting for the audience. So I'm going to share my screen right now and use a short presentation. I hope you see it. You can still see my screen. So today I'm going to talk about Kelvin Health and the application of thermography in the diagnosis of various types of diseases, or actually in the initial spotting during the screening procedure for various type of risk groups of patients. But first, before I start with the actual presentation, I want to just show you a live demonstration about how this thermal camera actually works. So first, let me show you. This is the camera that is actually attached to my iPhone. As you can see, it's very portable. And using a mobile application connected to this, you can start see the temperature. In this case, you can see live the various thermal zones on my face. I hope it's visible clearly through a webcam. As you can see, different spots in the body have completely different temperature. And this is actually very useful for the purposes of analysis that we're doing. So to start with a bit of a background, Imaga is the mother company of Kelvin Health, one of the pioneers in image recognition. We started working on this back in 2012, officially as a company, a few years before as a pet project, as a bunch of entrepreneurs and software and AI engineers. We've analyzed more than 25 billion photos for various types of customers across the world. We've trained one of the biggest, I believe, image classifiers in the world, classifying more than 30,000 different visual categories. And we've been recognized as one of the top in terms of precision and recall among even competitors, the likes of Amazon, Google, IBM, and Watson. So actually, a year ago, as Eva also mentioned, we were approached by a team of medical experts to address the problem of preventive medicine, and more specifically in the context of COVID-19 as it started coincidentally, to be able to screen various types of problems that maybe people are not spotting themselves. And I'll start with a bit of statistics, though some of them are based for the US, but I believe they're applicable more or less in any country in the world. So in the US, more than 70% of people avoid medical care and avoid both examination and treatment. And the problem with that is that there might be severe complications if you're not taking good prophylactic care for yourself. And I believe it's not, how to say this, it's not something uncommon for each one of us to be a bit lazy because of various reasons, either being bad access logistically or some internal worries about visiting a hospital. So this is even worse if we combine it with the fact that a lot of healthcare providers, actually less than 8%, have any type of medical care that is remote, the so-called telemedicine. And this means that if you're not going to the hospital or the primary care unit that you're visiting, as some healthcare provider is providing, you have problems with being examined at all. So this is even more specifically problematic in the cases of oncology diseases. If we take a look at the breast cancer situation, currently 2.1 million women are diagnosed with breast cancer. And this is a huge problem because if it's, this is oncology. And one of the key things about oncology is that the sooner you realize you have problem, the higher the chances for it to be resolved. So, for example, in oncology, early stage detection of the disease when it's in T1 means more than 95% chances of survival. Late stage detection of this kind of disease would mean less than 50% chance of survival. And as you can see from the statistics on our slide, more than 50% of the cases and more than 58% of the death cases by breast cancer are registered in less developed regions, especially because people in those regions don't have any efficient ways to monitor their health and to get proper examination. So it turns out that even when people are screened, 2.5% of them actually have some kind of breast cancer development. Of course, this statistic is a bit biased because it a lot depends, as Eva said, on who is going to visit the specific medical center. And especially in the US, the cost for treatment of breast cancer patient for a year is more than $100,000 US. So the approach of Kelvin is, I think, very caring for the patient in several aspects. First of all, it allows you on a regular basis to monitor some symptoms for anomalies in your thermal picture. Because the whole magic behind Kelvin is that if you have any changes in the temperature of your body, this would mean that there's something changing in the blood flow. And there might be different reasons for that. One of them is inflammation, another one is contraction, and another one is some structural change in the vascular system, which means that the blood flow is being changed. All of these have their impact on the body temperature because they have impact on the blood flow, and those directly are bidirectionally interconnected. So Kelvin aims to assist both the healthcare providers and professionals and the actual patients in the process of early discovery of various anomalies in the thermal picture and the thermal image of the patient. So to achieve that, we basically combine our expertise in the area of artificial intelligence and image recognition, in this particular case on thermal imaging, and of course combine it with medical and clinical science. So just to give you a bit more clear overview of the process, we have the thermal camera attached to the mobile phone or somehow remotely via Bluetooth or Wi-Fi to a desktop computer. Then one or more photos are taken of the patient, typically about 2 to 3 meters distance. A requirement is the patient to be naked above the waist, which still is not a problem if we talk about domestic environment or some kind of primary care unit environment. And of course, just as an environmental factor, is good you don't. It's suggested that you don't have any distracting factors for the temperature. So you don't have AC on, you don't have open windows, and you haven't been out at least for 10 minutes. So once this once the patient is in place, we can use the thermal camera to capture the light that is infrared light emitted by the heat of the body. And as I said, this can happen in any environment. One of the big breakthroughs here is using a mobile device for that purpose, because thermography has existed for many years. But this hasn't been something that can be used in the comfort of your home. And if you need to go to the hospital, there are other different methods that you can use in terms of medical imaging, and I'll do a bit of an overview of them shortly as well. So once the image is captured, as you also saw on my phone mobile screen, it's segmented. One of the major developments that we did in the last year is to how very precisely segment the image, because even small changes in the temperature should be spotted, so we can detect anomalies more easily. And after that, of course, the cherry of the cake, to say so, is the actual AI analysis. But AI, I wouldn't like to state that AI is something that should be mystified. I like to, to make AI look simple, and I believe to a huge extent it's simple. Of course, there are a lot of challenges. I think Eva did a great job in covering a good deal of them. But basically, if you can collect enough data that is diversely representing various types of groups, both in terms of demographics, in terms of various type of family history with diseases, ethnicity, which is also part of demographics as well, we can have a pretty good representative set of how a certain medical condition that is verified in other means look on the thermal camera. And this is actually the stage where we are. We're currently working very actively on collecting data for various types of conditions, and I'll mention about this a bit further during my presentation. So just to do a bit of a comparison between various types of medical imaging and our approach, I guess most or all of you have heard about ultrasound, X-ray, CT scan, MRI. These are all very varied and useful methods for medical imaging, but some of them have their downsides. Of course, Kelvin is not something that is aiming to replace those. Actually, it's aiming to be a preliminary step before using those, or actually something that alert the patient so they're urged to use any of the existing medical images as additional process of secondary care and more detailed examination of their health condition. But to mention some of the advantages explicitly, besides being AI-driven approach and solution, it allows you the regular checks, something that is, I think, quite unique because of its portability and because of the fact that you have no ionizing radiation. So basically, it doesn't have any significant financial or any radiation-related complications when you use Kelvin and the application of thermography. So it also allows the chance to work remotely very easily. Of course, it's innately related to the mobility and the portability of the device and the software behind it. And as you can see also on the bottom, the price of various types of examinations and medical imaging laboratory tests is increasing from the left to right. So in some countries, MRI, for example, is extremely expensive. So which are the main areas where the thermography approach is applicable? So something that we are currently focused on is oncology, and in more particular breast cancer, because breasts are very exposed part of the human body, and this is important because for the temperature analysis to work, actually temperature should be present at the skin level. So if we talk about an organ that is very deep into the body, this would mean that temperature is not well transferred and cannot be that easily spotted on the surface of the human body, which is the skin. So autoimmune conditions like rheumatoid arthritis as well, because any type of inflammation is directly related to heat and increasing temperature. This is something that all medical students always react very I'll say this excitedly, because one of the first things that they teach in medical school is that there are 5 different criteria for showing inflammation, and temperature is one of the significant ones. Also vascular diseases like thrombophlebitis, for example, where you have changes in the vascular system, and this results in changes in the blood flow, and also may lead to some secondary effects like inflammation, unfortunately. And a few more conditions where temperature is very well present, like problems in the area of dermatology, respiratory infections, and COVID in particular as well, something that was actually the origin of how we started, though it's not our main focus right now. And various types of traumas and injuries, where again you have both, typically you have both inflammation and changes in the vascular vicinity of the trauma. It's worth mentioning that pediatric care is also very friendly to this approach. This approach is very friendly to pediatric care, again, because it's something that is not directly related with visits to the hospital or very frequent visits to the hospital, and it's non-invasive in any way, which in the case of caring for our kids, it's pretty important. And I'm going to show right now a few images. They haven't been processed in any ways. These are directly captured with the camera and the mobile application behind our project. So here you can see screening for breast cancer for one of our patients, which is actually also one of the team members, to be honest. Won't disclose the exact name, but here you can see, I think if you take a look at the right-hand photo, you can see a very clear difference in the temperature of both breasts. And in this case, the left breast, which is on the right-hand side in the image, is significantly colder compared to the right one, which is a sign of something, because if you have an organ that is symmetric, like are the breasts, typically the rule of thumb is that their temperature profiles should be more or less similar. So in this case, this was validated as a fibrosis, which we can say, simplifying things a bit, but we can say that this is a precancer condition. So basically, if measures are not taken, there is a significant threat of developing cancer. Here you can see again, for the case of breast cancer, screening for 12 women. Most of them, screening of 12 women for breast cancer, most of them are relatively symmetrical. in their profiles, and there are a few cases where there are changes in the so there are difference between the left and right breast, as maybe you can spot as well. Um, Here is observation number 2, where we have rheumatoid arthritis that is currently actively inflamed. You can see obviously, again, if we use the pair of hands, we can see a significant difference between the profiles of the left and right hand. So just to make a side note here, maybe I'll mention this a bit later as well, but why is the monitoring of inflammation process important? It's very important in the case of application of drugs, because you need to dose drugs appropriately, so you can basically ease the symptom and mild down the inflammation, but you don't need to overdose, because most of those drugs have their unwanted secondary effects. So basically, you want to dose the drug properly. And this applies to practically any type of inflammation symptom related to a disease. So if you take the case of rheumatoid arthritis, for example, you want to properly dose the medications that are easing the pain, because unfortunately, still in current medicine, this is not a disease that can be permanently cured. So it's very much symptomatic treatment that you need to apply. Case or observation number 3, here we see a patient with thrombophlebitis on their right leg or the left hand on the image. As you can see very clearly, the places where they have changes in their veins are very visible on the bottom left. And this is related both to the increased blood flow and some secondary inflammation as a result of the changes of tissues there. Here, interestingly, you can see COVID progress in 2 days. The first one, day 1, is at the day of a positive PCR test. So it's not literally the first day of infection. It's the first day of applying the test, but still, you can see the visible change between day 1 and day 2 on the left and right hand side correspondingly. So interestingly, the patient here didn't have any significant change in their in their symptoms. But as you can see on the thermal camera, it's very visible how the infection is progressing, and there is consistently increased heat in the area of their chest, both at the front and at the back. So actually, this was the whole initial concept of Kelvin, and before we extended to more cases, some of which I mentioned just right now, to be able to spot increasing inflammation levels before the patient is actually feeling them. Because as with oncology, the time frame is very prolonged. It's still important to have preventive care, but if we have acute respiratory infections, it's also important to have very timely measures. So it's not a matter of weeks or months there, it might be a matter of a few hours or days. And this was the whole initial premise of Kelvin. I'm smiling because I remember the very, very early first days of this project when we were brainstorming on how this can be impactful for taking more timely and adequate measures in case of infection for COVID. Here, somehow similarly to the rheumatoid arthritis case, we have another observation of COVID, but in this case is the observation of treatment, unlike the previous case where you see a development in the day 1 and 2. This is another patient, and here you can see on day 5, and then on day 7, after application of cross antibiotics therapy, how you have significant change in the heat levels on the chest, which is deducted to be related with the change in the inflammation in the respiratory system of the patient. So observation number 6, an experiment that we did with a local emergency response unit in one of the biggest emergency response hospitals in Bulgaria. With the consent of the patients, we were able to take photos of various types of traumas and injuries, from sprained wrist to sprained ankle, broken toe, and broken scapula. And you can see that there are visible thermal changes in the profile of their bodies here. Observation number 7, and I'm finishing with that. I hope you like visuals and you're not too bored. So observation number 7 is changes in the blood levels after physical activity. In this case, this is the youth national team of basketball of Bulgaria. That is one of our research partners as well. So basically, you can see significant, well, I'm not sure if you can see it, but if you can imagine, compared to other legs that you were seeing in the last few minutes, how the quads, the muscles, the upper muscles of the legs are actually much more heated after physical activity. To be honest, they're an interesting catch in physical activity monitoring using this approach, because one of the main functions of the body is to regulate this temperature when it's heated. No, it's not one of the main, but it's one of the important functions of the body. So actually, when you're overheated, your body is starting to cool off. And this means that sometimes you might be very tensed, but actually on the surface, you start to cool down because you need to compensate and not overheat. So this is an interesting counterintuitive example where you can be very, very bloody or very pumped with blood, but still on the surface, you can be, let's say, normal temperature or even cooling down because the body needs to compensate. So things are not always too trivial and following straightforward intuition, but that's why we are actively working in collecting more and more data and doing active research collaborations. So we are working with several hardware partners for developing our own custom thermal camera right now, because this specific camera, it's a one brand, it's the FLIR brand, and this is the FLIR 1 series, which is a consumer grade camera where you typically use this to check your car or your heating system at home. Is it working properly? Or if you have some leakage in your central heating where in your wall there's a problem or leakage. And we just started using this because it was the very off-the-shelf usable solution where we can start collecting data. But we're currently exploring opportunities and options to build our own custom hardware that is very precisely oriented toward human temperature levels. Typically from 35 to 41 or 2 degrees Celsius. We are working in very close collaboration with NVIDIA. They've been a long-term partner for Imaga in terms of computational infrastructure, and a few more companies where we collaborate on both the hardware and the software and data protection side. We also established research partnerships both here in my home country of Bulgaria and internationally. So we are working with the municipality of Gabrovo, one of the big towns in Bulgaria, where a relatively big cities in Bulgaria, where we have the support of the local government for working with hospitals to collect data. And we're also doing the same with first gynecological hospital of St. Sofia in Bulgaria as well, especially for the breast cancer use case. We also started a research collaboration partnership with University Clinical Center of Maribor in Slovenia, and a few more partners that we still cannot disclose because we're currently in process of finalizing documents. Very importantly, we also started a joint research collaboration project with Novartis, and in particular Novartis Oncology Europe Innovation Department, their Biome initiative, which is actually an arm for innovation in pharmaceutical company. And we recently won one of their internal global innovation challenges called Breaking Barrier. So we are currently deepening our collaboration with them, especially for screening of patients with breast cancer or with the potential of developing breast cancer. So when we work with a research partner, the structure of this partnership is most likely exhausted to collaboration on data collection, where we combine the existing means of examining for specific condition and measuring its severity. and at the same time taking thermal images of the patients who give their consent for data to be collected. So we can basically cross-reference and train the machine learning models and advance the science in terms of what is visible and clearly visible in thermal images. As a result, practically we empower them to have another very portable and very easy to use short cycle tool, like our, let's call it combination between hardware and software, to have additional modality of examination of patients. Also, as I said, in some cases, if those healthcare providers have some kind of remote care units, they can allow their more under-equipped teams to have this kind of tool once it's been validated as a valid medical device. So there are different value propositions, and I'm going to end my presentation with that, with the various stakeholders in the healthcare system. So if we talk about healthcare intermediaries or the so-called health insurers in Europe, it's a portable solution that we can offer that can serve in the preventive medicine use case and eventually reduce huge complications for the patients. And thus, prevent huge complications for the patients, and thus also reduce the amounts that needs to be paid for healthcare. And this is not, just very greedy commercial thing. If you can save the health of your customer, basically you're going to pay less money after that for fixing their health. And so there's a good alignment between interest of all parties here. For pharmaceutical companies, as Eva mentioned, there are a lot of very complex process of both doing clinical trials and then monitoring patients. And also most pharmaceutical companies have their persistent patient care programs where they are monitoring the conditions of the patients after their therapy. So basically having a tool where on a regular basis they can monitor their condition seems to be very useful. For the healthcare providers, I already mentioned that basically we're giving them a tool to improve the primary care of the patient. And even on the governmental level, especially in less developed regions, but also in well-developed countries, if you need to do some kind of more mass-scale screening, like the COVID pandemic started, to generate some momentum for that, and how we can get a better nationwide screening of condition of patients, for example, especially if tests don't prove very precise, or for some reason logistically they cannot be performed very well. Having an instrument where patients can check themselves on a regular basis seems to be very useful. So on the pure consumer side, people who are in risk groups because of family history or some other conditions that might correlate badly with a specific another condition, it's useful to have a tool where you can check yourself. Let's call it on a daily basis or a weekly or monthly, depending on the specifics of the condition. In general, people who are health conscious and then want to get a better status of their health, professional sport teams, as I said, with my last use case, is something that we are also currently exploring. So this is the end of my formal presentation, and something that actually got us very excited, because as I said, we've been working in image recognition more than 10 years practically. And we were staying aside from medical imaging for various reasons. One of them being that, we knew that there's a lot of complications, there are a lot of regulations, and we lacked the medical expertise on the team back then. So the COVID pandemic was a very interesting occasion with all the unfortunate consequences of that, for many businesses or for many people who lost their lives or their relatives' lives, which is very unfortunate. But at the same time, it created the opportunity and the momentum for more and more telemedicine, and at the same time, for people being more open to adopt various type of AI solutions, especially if the scale of the healthcare that needs to be provided needs to be increased. So we believe that even looking from the commercial point of view as a company, we can still create a lot of benefit in general in the preventive care and healthcare for people's lives, and bring some kind of positive change on how much a disease can develop without it can be spotted, in the direction of it's being spotted early enough, so the adequate and timely measures can be taken. Thank you very much for listening to my presentation. And I'm seeing some chat pop-ups. Maybe people have questions, but I'm still not seeing them, not to distract myself during the formal part to say so. So now I'm happy to open for discussion and eventually take a look at your questions.
Thank you, Georgi, for the amazing presentation. It was really mind-blowing and insane how everything is moving forward so fast, and how many things have you achieved only for 1 year? Like, yeah, starting the company 1 year ago and being there right now, it's really amazing. And yeah, thank you so much for all the insights and the presentation. We have already couple of questions in the chat, so I will start reading them. The first one is from Angela. She's thanking for the presentation, and her question is, would be interesting to know whether there are any particular mobile phone minimal requirements for your service, for your solution.
Yeah, so just to mention, thank you very much, Angela, for your comment and the question as well. So currently, our solution works with any type of iPhone beyond iPhone 6s. And but basically it can be downloaded on test flight, but there are several limitations here. First of all, you need the thermal camera itself. It needs to be attached to your phone. And second, I want to make it very clear that actually it's not a functioning automated solution yet. We don't want to release it in any intermediary state because there's a huge responsibility both on the legal and the moral side of that. So we're still in very active process of data collection. So this application that's accessible through test flight on the iOS is intended mostly for people in research collaboration centers that we work with, so they can install this and start taking photos of the people who give their consent. In the future, we plan to basically support any type of mobile device, and actually even allow connection directly with the desktop computer, so we don't necessarily need to plug the camera in your phone, because it looks cool. I agree, plugging this in your phone and it starts to be a smarter gadget for your health. But at the same time, it's not very convenient if you need to carry this thing around with yourself, and thinking about breaking the plug and stuff like that. We broke a few cameras just by pushing them in and out 1,000 times literally. So long story short, we are planning to make this very accessible and easy to use in terms of how to say this, packaging it as a hardware that's convenient for the consumer. But still, we are far from commercialization. Literally, between 13 and 15 months from now is the moment when we plan to release something that will be available to general public. Though we want to be earlier, but at the same time, we want to be very cautious and responsible about the precision of that.
Thank you for your answer. And we have another one from Laura. You kind of answered partially to it, but maybe you can add some other things when I read the questions. So her question is, I know many are concerned about health record privacy. How is the data that is collected and used to improve systems protecting patient privacy?
Yeah, it's a great question. It's a very
Georgi, I cannot hear you. I don't know if it's the same with everyone.
I'm not muted, which is kind of strange though.
Now we can hear you.
Oh, you can hear me. Okay, I was telling that it's an important question that we're very cautious about as well, and something that actually was preventing us from doing anything in medical images in the previous years before Kelvin. So currently we try to collect as much anonymized data as possible, and always with the explicit consent of the patient. So we don't use any existing medical records or something if we don't have the explicit consent of the consumer. And actually, as I said, it's not still something that's released to the consumers themselves. it's something where we work in collaboration with hospitals and other medical research centers. So basically, they need to collect the consent of their customers or their patients, and then we store typically only the thermal image, which is not how to say, it's not reversible to a particular human being, and then we don't collect any private data, any personal data. We only store some identifiers. We still leave it to the hospital or the healthcare provider unit to be responsible for collecting their data as they do. We just need to securely, under all GDPR and HIPAA related regulations and best practices, to store this data. And just to wrap it up, we store the images themselves and some kind of condition confirmed by a physician. We don't store any additional data. Even demographics is something that we try to anonymize as much as possible. For example, it's not a particular age, it's an age group.
Mhm. I see.
I hope I've give exhaustive answer to that.
And the other question again from Angela, since you mentioned that you worked with medical professionals at the R&D stages, have you embedded any mechanisms for exporting the data from Kelvin for the patients reacting to anomalies detected by Kelvin to share with the medical professionals who will be treating the patients?
Oh, it's a lot on my plate. I'll need to reread this in the chat to make sure I'm not missing anything.
Okay.
Yeah. Yeah, I think that I'm the only one who can make that complex sentences containing multiple how to say aspects of it. So I'm not sure if the question is toward patients being able to export this for their use, and one of this particular use might be sharing this with their physicians or general practitioners. So this is in the consumer. If that's the question, in the consumer version of the application itself, it's actually intended to work with the professional on the other side who is not doing the analysis, but is doing the analysis of the AI analysis, to say so. It's a bit of tautology, but so basically, if there's some signal that has been spotted by the application, this is something where the user have the opportunity to alert their general practitioner or specialist, or in particular, the authority, whatever it is that is monitoring their condition. So also all these thermal imaging photos, they are stored on your phone. If you'd like, you can do with them whatever you want. They're not our property. We just do the analysis of what's in there. And of course, we generate them in a good way where you have high contrast of what's captured by the thermal sensor. But if Angela would like to elaborate when I'm not understanding the question correctly, I'll be happy to do so.
Angelo, would you like to add something or?
No, that's fine. That's completely what I was asking. Basically, how they could export the data they have, but since they're the ones who have ownership of the data, once it's collected, then it makes perfect sense for them to distribute it however way they want, even with medical professionals afterwards if they are reaching out to get treatment. Thank you.
It's my pleasure.
And we actually have one more question from Angela. Also, it would be interesting to learn whether you have any system or for backtracking the success rate of early detection, basically following up on how many of the patients who were alerted by Kelvin ended up getting diagnosed accordingly at medical facilities afterwards.
Yeah, so in the consumer stage, this would be very important statistic. In the current research stage, it's also something that basically it's innately related to the data collection process, because a lot of examinations, they're not immediate. So basically, you don't know your diagnosis at the moment of taking a thermal image. So in our software that is for collaboration with research centers, we basically generated those specific unique anonymized identifiers of patients, and if there are any changes in their condition, this can be submitted to us. So basically, we can update our data set ground truth in terms of what's visible on these particular photos that have been taken of this patient. But yes, it's a great idea, and it's a great concept that a constant feedback loop should be involved in the process. And this is actually one of the big promises of AI. And your next talk is about big data. And here, big data is not just a hype word. It's actually something where, if you think about it like that, we can basically collect, how to say this, we can gain knowledge and we can collect the thermal profile of a disease across a very wide population if we go on the global scale and if we go about the consumer case. And if people are taking photos of themselves and then they confirm a diagnosis, this is a huge crowdsourcing of data and a huge ability to learn specific conditions on a very, very diverse population. I think this is the big vision as well, to make these things precise, giving this tool in the hand of the consumer. Of course, there are a lot of different questions about the validity of those feedback that they are going to do, because intentionally or not, they might provide false data as well. But it's a big challenge and a big opportunity at the same time.
We have one more question from Garrett. Does the camera technology prove to be a limitation, especially since image resolution might affect any analysis that you may do with the image, or is the software that analyzes these images still a challenge?
Yeah, thank you very much, Garrett. Also, thank you for keeping your camera on and being a positive, smiley person during the whole talk. This was pepping me up as well. Yeah, the camera itself, having a quality camera that is mobile has been a challenge for quite some time. I mean, in the previous years of thermography, it's still a challenge nowadays. I can say how to make this an affordable hardware, because this camera, for example, it costs €400, and the quality of the image it gives is good enough for some conditions. For example, it seems that for breast cancer screening, this will be a good enough quality. The honest answer is that we still need to validate that. The hypothesis is that it's good enough, but we still need to clinically validate that. One of the reasons why I stated that we are working on improving the camera itself, or make it's actually a multi-aspect question. So we want to make it more affordable in terms of pricing, and at the same time we want to make it more precise in the range of human temperature, and also eventually make it more sensitive in resolution as well, in terms of spotting smaller spots of change in the temperature. But yeah, I'll repeat myself that it's still to be validated how good the current hardware is for the purpose that we're applying it. Hope I answered that question.
Thank you.
My pleasure.
And like multi-aspect question from Oliver. On the first place, what is missing for a fully automated product in terms of AI development? Then what are the open legal and moral questions? And how can we help you with brainstorming these issues?
Thank you to Oliver as well. I saw his camera on for some time as well, or maybe the whole time. So thank you also for jumping in with a question. So what's missing is it's mostly a big enough data set with clinical validation of the same images. So as long we are building various types of data sets, and they need to have some statistical power and validity to be able to more confidently say and even test and validate internally our own algorithms, how well these machine learning models have been trained. Once we have that, we will be more confident in putting this to work in an automated mode. And as well, you've tackled on the question on legal and moral questions. Legal in medicine is kind of how to say this, an interesting topic, because basically legal means that if you've checked some checkboxes, some of which are very hard to check, but basically if you have checked those checkboxes, you're good to go, whatever this means. So let's say if you comply with the standards of a clinical trial, in terms of statistical representation, processes, certified devices in the process, etc., then you can basically publish a result and you're good to go afterwards. And you may state things like, these things work 85% precision, and that's the way it is. And that's part of the approval process in the certification process. This is a device that works with this percentage of precision. It doesn't need to be 100. It's good if it's not 20 as well. But basically, you have from if we just how to say this, relate this to the marketing perspective, then you can say I have solution or device that have X% of precision, and it's not 100, unfortunately, as it is not with drugs. They're not curing diseases in 100% of their intended use, unfortunately. So on the moral side, there are two questions that are very valid in general in AI, but also even more in medical cases and healthcare. So one is of the false positives and the other is of the false negatives. So false positives are the smaller evil, to say so, but they're still evil. So for example, false positive would mean you don't have a problem, but the application alerts you or your physician with an advice that you take some measures. So for example, go screen yourself with mammologist for potential breast oncology. This might be in a way traumatizing and alerting without the need to do so. So it's a question if it's good to be safe than sorry, as they say, or if it's good to keep your peace of mind and not be distracted, even if there's a chance that you have some problem. So it's not an easy question to answer. It's again, it's somehow from the legal point of view, it's just defined as such. And you might know that as you've seen on different devices or something, or even lab test results, they say lab test results are not diagnosis. You need to consult with a physician to get their reading properly. So it's more or less the same, but still you can have the alert. Another problem is, of course, of the false negatives. So which would mean in particular case, you have a problem, but it's not spotted. So this is again a problem, and this also needs to be defined. And what's the chance of this happening? As with any type of device, and even more in any type of automation, you need to you need to take a second opinion in case you have a problem. You think you have a problem, but it's not spotted. So very valid questions. As you suggested, some brainstorming help. You can help, both right now and in the future. We can keep contact. I forgot to tell that, my name is Georgi Kadrev, as I was introduced. It's written Georgi Kadrev. And basically, I'll be happy to add me on LinkedIn and keep some communication going if you'd like, whatever things related to technology, AI, entrepreneurship, and healthcare. I'm very open to discuss. So, Oliver, if you have any ideas on brainstorming, there are so many things from the moral questions that you mentioned to collaboration partnerships that you might have in mind, who might be a good beneficiary of such type of services on the business development side, to who might be a good research partner, or just even sharing some common sense from the user perspective or the potential user perspective is very valuable to us.
Wonderful.
I hope
So open for cooperations and connecting people. And thank you so much for the informative answer. And we have one more question from Yuvraj. I hope I pronounced it in a correct way. Can this thermal imaging data results of Kelvin be used as an actual report by conventional hospitals and medical institutions? And can the Kelvin reports replace actual MRI or thermal reports which are diagnosed and reported by actual instruments?
So I'll give the short answers first. The first part of the first question, the answer is yes. The second is more like no. So the idea is that this thermal imaging data is at a certain moment at a very wide scope of application. So let's say all patients who have potential for some kind of conditions or complications to be screened with that, because as I said, it's very friendly for mass screening. And these kind of thermal analysis to be used on a very wide scope and statistical level to see, levels of inflammation or specific screening initially, leading then to more complicated procedures. So if I bridge over to the second part of the question that is about MRI, we don't think that thermal can replace MRI, and it's not intended to. It's intended to, as I said, spot eventually some kind of early signals of a problem that might advise that MRI might be a good option, for example. And of course, it depends very much in which part of the body and for what purpose, because as I briefly mentioned in the beginning, if the body part or the organ is very deep in the body under fat tissue or some other kind of insulators in isolation, like the rib cage or something, this changes the thermal dynamics profile. So even inflammation in the lungs might not be very well spotted on the front where you have the chest muscles. That's why typically the back is more exposed, though still there's back muscles as well. But there are a lot of, how to say, anatomically defined challenges to thermography, and more advanced imaging methods are solving this to a certain extent, but they might be very expensive as an initial procedure. And using the thermography as some kind of assistive diagnostics instrument, which is not intended to give a diagnosis, but it's intended to give a better intuition, to say so, on what needs to be examined further and how urgent it might be. I hope I've answered the question.
Thank you so much, Georgi. It was a really amazing discussion, and I'm very happy that so many people asked so many questions. It was very, very nice and interesting. As for me personally, definitely it was very eye-opening. I hope it was the same also for the other participants. And yeah, thank you so much for your input. Amazing work. I wish you personally all the best and a lot of success in the future. And definitely solutions like that are needed, especially for early detection. I can say it also from my personal experience. So yeah, thank you for being present and for doing what you're doing.
Thank you very much. And as I said, I'm very open, and I'll be happy to get in contact with the people from this webinar, both the Zoom and those who are watching live on Facebook. Reach out. We are open for collaboration. That's very much embedded in the culture of both companies that we operate. And yeah, thank you again for the opportunity. I hope it has been productive and exciting. And I hope that we'll be able to, all of us will be able to use Kelvin in the foreseeable future as something that's inherent part of our better health and preventive medicine. Actually, I forgot to mention something. Some phones as of today have thermal cameras. The middle camera here is a thermal camera, very similar to the thermal camera here. So we envision that in the not so distant future, the major mobile phone brands will actually have thermal cameras, and we want actually to be part of this and the momentum that would generate this kind of move. If we can prove that on a mass level this kind of analysis can be applied, it would make sense that basically any phone can have a thermal camera and be useful for this type of application, eventually powered by us.
Amazing. And good luck with the development of your own camera, as you mentioned during
Thank you very much. Yeah, we're working on that as well.
Yeah. Okay. So thank you once again, Georgi. Thank you all of the participants who joined us and were with us during the whole event. Don't forget to take part in our next brainstorm talk. Just like a small mistake, the date is 27th of May, not 19th. I'm sorry for the mistake. We're looking forward to welcome you for the next topic of big data. And yeah, I wish you all the best. Stay healthy, stay safe, and let's hope for better weather as well. And yeah, enjoy your evening.